Good morning everybody. Myself is Professor Dr.R.R.R.Deshpande. Today is Wednesday. It is the 20th of June 2017 and we are here with my PG students to talk about the Ayurvedic Panchakarma lecture series. And in this Ayurveda Panchakarma lecture series, we have already talked nearly 3 sessions for the Snehana, and we have already completed the 2 sessions of Svedana Karma. Svedana is nothing but the fomentation or the sudation. So today we will start the Svedana Karma part 3. In this session, let us start with the procedure as such. What is the procedure or SOP? In NEBH language, it is always called as a SOP, that is standard operating procedure. Systematicness should be there. First is a written consent of the patient. Especially written consent is very important for the patients of high blood pressure. Very important. High blood pressure and ischemic heart disease. And also I will add the patients having the varicose veins or especially deep vein thrombosis, DVT. Because of the Swedan Karma, they may be little bit liquefied of that thrombus, and emboli may form, and emboli may stuck up in the either brain or the heart or the renal. So it is better to take the pre-consent. Then confirm the indications and contraindications, that is Swedan or Aswedan. That you have to confirm. Another thing that you have to do as a pre-operative or pre-Svedana is better way you do the hemogram to rule out the anemia, because anemia is also a very delicate condition and that patient may not tolerate the Svedana Karma. So hemoglobin is must. Next important is BTCT. BTCT is very important. Bleeding time and clotting time. Because if the patient is already suffering from hemophilia, purpura, idiopathic thrombocytopenic purpura, then the patient after Swedan may land into the bleeding problems like epistaxis or hematuria, etc. So better way, bleeding time and clotting time is better to be taken or done before Svedana Karma. Proper history is important, especially about the peptic ulcer, and also menstrual history is important, because if the lady is suffering from the menorrhagia, metrorrhagia, heavy bleeding, that is of course the anarha patient, rakta pitta type of complaints, so you should not do the Svedana Karma. And of course you must also rule out in the obstetric history or the gynec history LMP, last menstrual period, to rule out the pregnancy, because pregnancy is also a very delicate thing, and the Svedana Karma is moreover should be done very in a delicate manner, or otherwise don't do the Svedana Karma. Now, pre-treatment of Svedana Karma, if we want to do for Panchakarma as a Purva Karma, then Snehana Svedana is a twin therapy. So before Svedana always the oleation or Snehana or massage is done, especially if you are doing the Svedana for Amavata, then of course we first give the massage and then we give the Svedana Karma. But of course it depends which type of the oil massage should be done, with the hot oil or with the little bit softer oil. For example, if it is Amavastha, then Vishagarbha Tail is applied, and Ruksha Svedana, that is the Svedana with the Valuka Sved or hot sand, it is given. Then you have to decide the type of the Svedana fomentation, whether you want to give the for whole body with the peti, Svedana peti, or if you want to give the Nadi Sved or the local fomentation, that you must decide. Then of course you have to decide or you have to tell to the therapist, mild fomentation or moderate fomentation or stronger fomentation for longer duration. So it has to be very clarified as per the patient's condition. Then how much time it should be given? As we know, Samyak Svedana Lakshana. The Svedana should be given till the Lakshana of Samyak, optimal type of the fomentation should be there. What are the symptoms or clinical features? The patient will start perspiration. He will start to get the Sved, or the Svedana will start, and this particular sweat is observed on the forehead, then in the axilla, chest region, and on the extremities. If the sweat is started, then you can understand, okay, now the Swedan is nearly completed. Then also the patient will get a little bit comfort feeling, because firstly he will have the severe pain, and after 2-3 minutes he will say, okay, I am feeling little bit light, I am feeling like pain is little bit reduced. So pain will little bit reduced, stiffness will reduced, and especially the feeling of shitata will be reduced. Before he has a feeling of congestion, stiffness, coldness, that will be totally removed. Suppose in winter season, in the rainy season, patient is shivering and you give the nadi swed. Afterwards you say, oh, no, my coldness has gone out. So his shita feeling will totally vanish. It will be removed after the Svedana karma. And he will feel softness in that particular part, feeling of lightness, feeling of the warmness. All these are the features of optimal fomentation or Samyak Svedana Lakshana in Ayurveda. Now, in the same time, you should know what are the features of intense fomentation. That means Ati Yoga Lakshane. Whether my fomentation has given him trouble. That is called as a Ati Yoga. Excessive fermentation has been done. So, what will be there? So, and why it is developed? Because of the improper selection of the patient, first thing. Because you have not selected the proper patient. For example, you selected the patient of cachexia, that is the tremendous weight loss in the tuberculosis or cancer. Or if you select the patient after the loose motions and vomiting, that is gastroenteritis. Patient has already 2 days back severe vomiting and diarrhea, and now today he has come to you for my joint is paining. So that patient is already dehydrated. So you should not recommend him to apply the Nadi Swed or the Swedan Peti because it is a contraindication. After dehydration, you should not give the Svedana Karma. So these patients then will start excessive thirst, which is called as a polydipsia. He will say that my tongue is dry, I am feeling thirsty, my palate is dry, and I am feeling dryness in my mouth. So that is a dehydration symptom. Then sometimes he will complain of giddiness, I am feeling giddy, and he will fall down. Sometimes he will complain that I am feeling the blackness in front of the eyes. That is also a complaint of prior to the fainting attack or the giddiness, vasovagal attack. So these all the symptoms are quite comparable with the sunstroke. In the sunstroke also I have already complained that the patient is having exposure to the excessive heat. But there the difference is that in the sunstroke there is absolutely no sweating, only redness is there, and the shock complaints are there. The BP will be fall down, feeble and fast pulse will be there. So that is a feature of the sunstroke. Now all these Ati Yoga patients, they must be tackled very carefully and very urgently, because it is a very danger sign, and if needed you can shift that patient to the ICU. Even the patient has unconscious or the shock, then you have to give the IV fluids, and rehydration should be immediately taken care of. So sometimes it will need the ICU type of the management. So you can write down that Ati Yoga, sometimes Ati Yoga, the patient will need the ICU for treating the shock. Now, after these Ati Yoga Lakshana, some Ati Yoga Lakshana will be seen locally. For example, while giving the Nadi Swed, the patient will get the burn. Write down, burn will be there because of the mismanagement of the Nadi Swed. So in these burn cases, it has to be treated like a burn management, and you can apply the Jatyadi Tail. The application of Jatyadi Tail dressing should be done immediately. Some patient will complain burning of eyes, burning of palm and burning of sole. So everywhere because of the excessive heat there will be burning, sometimes burning of the whole body. As the Pitta and Rakta are Ashray, even the blood get vitiated, Rakta Dhatu get vitiated, and the patient may start bleeding from the nose, that is epistaxis, because of the Ati Yoga of Svedana. Epistaxis is main complaint. Some may start the bleeding from piles. Previously he has a piles already. So in the next day he will say, doctor, I got the bleeding from my piles. Some patient, their blood pressure if they are a little bit, what you can say, the vulnerable patient, BP will be shoot. So there is a danger of shooting of the BP. So in Swedan Atiyoga, if the patient is already hypertensive and he is unstable type of the hypertension, then there is a risk of that his BP may shoot, and extreme case there is a possibility of brain hemorrhage. So you should not forget this possibility and be careful for the hypertensive patients. Then in the Atiyoga or excessive fermentation, there will be palpitation, then fainting, vertigo or the giddiness. There will be excessive sweating, excessive thirst. Then in the next day or in the evening, he may suffer from fever type of the hyperpyrexia type of the symptoms, hyperthermia, skin can become red and hot, very similar to the sunstroke. The patient may get the vomiting and he may get the burn injuries on the skin. Okay. So this is all about what can happen as a Atiyoga type of the complaints, excessive fermentation, excessive Swedan. What should be done after the Swedan? That is called as a Paschata Karma. Paschata Karma. So after the fermentation, the patient should avoid a cold breeze or the air, because that is called as a incompatible type of the lifestyle. You have already taken a lot of heat and you are exposed to the extreme cold. That is antagonistic. According to Ayurveda, it is called as a Viruddha Charya. Viruddha Charya. Opposite or incompatible lifestyle. So this should not happen. The patient must avoid the breeze and he must take the full physical and mental rest from 5 minutes to half an hour. Minimum this time is required, adequate time. Then afterwards he take a little bit lukewarm type of the water bath, shower, and afterwards when he feel totally hungry, he can take the light, easily digestible, nutritious food like the khichdi with moong dal and rice. So khichdi will be the very best to get the, what you can say, the resetting of your organs. Now here we are going to see a different types of the special Svedana Karma. So first we will talk about Patra Pottali Svedana. Patra Pottali Svedana. It has the different names. Another name is a Patra Pinda Sweda. Patra Pinda Sweda. In Malayalam or South Indian language, the spelling is Ilakizi, E-L-A-K-I-Z-H-I, Ilakizi. So this is their traditional name in their local language. So this is a leaf massage because Ila is a leaves, E-L-A, and Kizi, K-I-Z-H-I, is a bolus bag massage. Bolus bag massage with the leaves. So to perform this particular, this is a sweating therapy, Svedana Karma, in which fresh leaves are fried. Fresh leaves are fried with other herbal ingredients, tied into the bolus, dipped into the warm medicated oil, and then applied over the whole body or affected body part, local or the general. The herbal bags are sometimes padded over the joints. They are tied on the joints, and so it helps to drain the toxins and they give the wonderful results for the muscular tension. The muscle tension is immediately relieved because the toxins are drained away. Lymphatic drainage will increase, vascular drainage will increase. It is applied after doing the abhyanga or oil massage. It is not directly applied. First we have to do the oil massage and then you have to apply. Now what are the indications for this Patra Pottali Sweda? It is the best for Vata dosha because any pain is because of the Vata dosha. Vata drute nasti ruja. Vata drute nasti ruja. Secondly, it is also helpful for Kapha dosha because Kapha dosha has the property of Shita and Swedan is antagonistic to the cold. So it takes care of the cold property of the Kapha dosha. It is useful for the backache, chronic backache, joint stiffness, muscular pain, then sciatica, then cervical spondylosis, lumbar spondylosis, sprain and cramps, especially cramps are there in the calf muscle. It is also useful to give the Patra Pottali Swed. As a even Swasthakara, if you are taking the Abhyanga, it can be followed by the Patra Pottali, especially in the obese patients. So it can be like an anti-aging or rejuvenation for this Kapha predominanta Prakruti, anti-aging and rejuvenation. It also helps to weight control, reduction in the weight and shaping of your body. Especially there is excessive fat accumulation in the abdomen, in the lumbar region, in the thighs. You can reduce it by applying the Patra Pottali Sweda. Now what are the materials required? That you must write down because it is very practicable. 500 grams of leaves. 500 grams of leaves of together Nirgundi and Dhattura. Say for example, Nirgundi will be more, 300 grams, and the Dhattura leaves will be of 200 grams. Then you will require the cotton cloth, and that measurement will be 18 inches. You have to measure it. You have to cut pieces of the cloth, 18 inches cloth pieces, 2 in number. There should be two boluses. So cloth pieces will be required 2. Then 5 feet long cotton thread. You will require the cotton thread because you have to tie the 2 boluses. So one bolus will require, say for example, not exactly 2 feet, I will say it may be little bit less also, but according to as per your requirement, you should take the thread to tie down that boluses. Then medicated oil, of course, like Sahachar oil. If it is a Margavarojanya Vata Prakop, then you can use the Vishagarbha oil or the Sahachar oil. Then how to prepare the leaves pack? So first a little bit oil is taken in the frying pan. In Marathi we call it as a tawa. You have to take the little bit oil, or kadai we call it. So frying pan, you should take the little bit oil. For what? To fry the leaves. You have to fry the leaves. Of course before that you have to cut the leaves in the pieces, and then you have to put in the vessel. Okay, cut pieces. Vessel with the round bottom, what we call it is a kadai in Marathi. And with the continuous stirring, the leaves are fried till its color change to the brown. Till its color change to brown. Then you have to spread the cotton cloth on the working table. On the table you have to spread the cloth. Then whatever the fried material is put onto the cloth, and then specifically that bolus is prepared by specific tying down that bolus with the thread. So these packs are prepared. Then next step is take the 200 oil again in the pan, which should be kept on the burning gas. It should be mild burning. The oil will be start little bit getting warm, and then you have to put that bolus into the warm oil and then rub it on the affected part. So every time when you apply the bolus on the part of the patient, first you yourself check. The doctor should or therapist should check the temperature of the bolus when you put it on the warm oil and applying on the body part of the patient. Before it, in between, you have to take the judgment how much warm it is, and then if it is tolerant to you, that is Vaidya or therapist, then it should be applied to the patient, not directly taking from the boiled oil. It should not be, that bolus should not be kept on the body part of the patient. Then for the patient, no specific type of preparation is required. It can be performed at any time of the day, but before application of the patient should what you can say, the violate their urine and the natural urges. So he should not control his natural urges. Na vegan dharaniyat. So naturally, before any treatment, his bowel should be opened, that is must, and urination should be there before starting any treatment, any damn panchakarma or pre-operative. The patient should be asked to go to the toilet, and then the treatment should be started after cleaning his hands and legs. And then you have to apply the oil and start the fomentation. So oil massage will be there, and then the particular fomentation. So application of the heat to the joint, herbal packs are momentarily touched to the joint, and it is like on and off, touch and take away, touch and take away. Or another method is to rub circular manner on the joints. In the trunk also, while applying anywhere, while doing the massage, while doing the fomentation, you must know little bit about the muscular arrangement on that particular part. What sort of the muscles are there, where is the origin, where is the insertion, whether it is a flat muscle, whether it is a vertical muscle, whether it is a round muscle. You must know the little bit shape and size of that muscle where you are applying the oil as well as the fomentation. So that anatomical basic knowledge should be there with the Vaidya or the therapist. And normally it is done in a Anuloma Gati, that means from upwards downwards according to the hair. It should be applied in Anuloma Gati. On the joints it is applied on the circular manner, round. Then you have to apply on both sides, that means from the top as well as from the bottom of that joint. Especially if you consider the knee joint, it should be applied on the patellar region as well as it should be applied from the popliteal surface. So both the areas should be covered for massage as well as for the fomentation. Okay. Now next, after the procedure, again the same things are there. No fan, no AC. He should comfortably, well ventilated, well roomy area should be there, but he should take the rest for some time and then go for a little bit shower. Then risk, as we already talked about, the basic risk is, here it is a local fomentation. So not risk of like a hypertension, because it is a local phenomena. So only the risk is about the burn, to get that part burn, and skin burn will be there. So you have to make a dressing with the Jatyadi Taila. Now next Swedan Karma we will talk about Pinda Sweda next. This was Patra Pinda or Patra Pottali. Now we will talk about Pinda Sweda. It is also called as a Shalishastik Pinda Sweda. Shalishastik Pinda Sweda. This is the massage performed with heated bundles of rice. Heated bundles of rice cooked in milk and soaked in herbal decoctions. So oil is also there, decoction is also there. Advantage, specific advantage is there. This is the only therapy where simultaneously you can do snehana as well as svedana, because rice is like a snigdha dravya. So simultaneous snehana and svedana is done with Shalishastik Pinda Sweda. It is also called as a Navarkiji in South India. Navarkiji, Navarkizhi. Navar, the meaning of Navar is medicinal rice, grows in 60 days. Navar, what is meaning? The rice cropped up within 60 days. Now indications. It is a therapeutic measure for mainly degenerative type of conditions. Degeneration. Suppose Patra Pottali was basically a type of for Margavarojanya Vata Prakop, but Shalishastik Pinda Sweda is basically Dhatu Kshayajanya Vata Prakop. But it doesn't mean that it should not be used in Strotorodhajan. It can be used, but more use will be for a Dhatu Kshayajanya Vata Prakop, when patient requires nourishment as well as cleaning. Do you understand? Nourishment plus cleaning, both things together. So basically degenerative condition, it's a Rasayana therapy, rejuvenation treatment, anti-aging, After the massage, full body massage, one can get a Navarakazi once in a month. It's a very good type of making your body tone very nice. Neuromuscular disorders like hemiplegia, paraplegia and muscular dystrophy. In all these cases, Shalishastik Pinda Sweda is must. Neuromuscular conditions. Also, I can add something like, for example, Guillain-Barré syndrome. I am repeatedly telling you, Guillain-Barré syndrome. You can use this to improve the muscle strength and bulk of the muscles. Upachitatva according to Ayurveda. So, nutrition will be improved, tone will be improved, and so it is useful for wasting type of the disease. Whenever there is a cachexia, loss of weight, always you use the Shalishastik Pinda Sweda in tuberculosis, cancer and HIV patients. Emaciation is there, debility is there, use Shalishastika. Then body ache, for example osteopenia, osteoporosis, these conditions you must write. Asthikshayajanya vikruti, majjakshaya, mausakshaya, asthikshaya, 3 words I am using. Mausakshaya, when there is weakness in the muscles. Asthikshaya, when you have the deficiency of calcium, vitamin D3, your laboratory results are showing my body is having less calcium, less D3 and less B12, then you must recommend Shalishastik Pinda Sweda. Nowadays these cases are very much all around your society. So osteopenia and osteoporosis, both the conditions you must remember. Then cervical and lumbar spondylosis, osteoarthritis. What are the material and methods or other materials? Again the square shaped cotton cloth piece, 18 inches, but here you will require 4. Previously you required only 2, now here 4. Then properly cleaned Navar rice, 200 grams. Rice 200 grams. Write down. Rice 200 grams. If you do not get the Navar, take any rice, no problem. Rice 200 grams. Don't forget the measurements. Then coarse powder of bala root, Sida cordifolia. Coarse powder, bharada churna of bala root, that is Sida cordifolia, 250 grams. Write down these measurements, 250 grams, Sida cordifolia bala root. Then you will require the 1 liter of milk, 1 liter of milk. And also there should be some threads to prepare that bundles or the packs. Now let us see how to prepare the rice. How to prepare the rice. Take a vessel, add 250 grams of bharada churna of bala. In that 250 gram of bharada churna or the coarse powder of bala, you have to add 4 liters of water. 4 liters of water and then cook it or boil it till you reduce that water up to the 1 liter. I will repeat, 250 grams of bala bharada churna, add 2 liters of water and reduce it to the 1 liter of that water. So we were talking about how to prepare the rice. 250 gram of the bala and 4 liter of water, cook it and then it has to be reduced to the 1 liter. So 1/4 should be the reduction. You have to evaporate the water. This decoction, 1 liter of the decoction is mixed with 1 liter of the milk. Every step write down very carefully. This is a practical notations. So for the listeners I am repeating everything 100 times because it's a must to write down. 250 grams of bala bharada plus 4 liter of water, put it on the gas, cook it, boil it and reduce that water to 1 liter. How it is done? Actually first we have to put the 1 liter. You have to see the level of the water and then you have to add the 3 liters so that you can understand how much should be reduced. Afterward you will not understand. So first you put 1 liter, see the level in the pot, then add 3 liter, start the fire, gas, and reduce it to the 1 liter. Okay. So 1 liter, filter it and keep ready 1 liter of the decoction. Add 1 liter of the water together. Sorry, 1 liter of the milk. I am sorry. 1 liter of decoction plus 1 liter of the milk. Then next step, you have to take the pressure cooker. 200 gram of the rice, add only 500 of the above said mixture. That mixture is already prepared, is a 2 liter. Do you understand? But only we are taking the 500 ml in the pressure cooker with the rice. So for cooking the rice, we are using only 500 ml of the mixture. What is that mixture? Of the decoction and the milk. Am I correct? So 1.5 liter is already kept aside. Okay, so keep it in the pressure cooker, make the 3 whistles, then rice will be cooked and that will be ready for the Pinda Sweda. So you have to put the 4 cloth pieces of 18 inches on the table, then put it cooked rice in equal parts in that 4 bolus, tie that boluses with the thread, with the specific method is applicable there, that 4 corners are approximated and free end of the cloth is folded on the top and then the string is tied. So the packs are ready. Then remaining mixture of decoction and milk is then little bit boiled. When the mixture starts boiling, that whole the 4 packs are kept in that vessel, in that cooked boiling mixture. Okay. Then patient is prepared with the synchron massage or the body massage, and then 2 therapists will stand one on either side of the patient, and then they will take the 2 in the boluses in their hand and start preparing the rubbing on the whole body systematically. There are different methods how to start. Some, for example, we start from the peri-umbilical region, because personally I believe that Agni is the most important part of the body. Where is the Agni? Agni is situated in the Nabhi, Grahani Pradesh. So Pachak Pitta. So we start in the abdomen, then the chest, then the hands, then the legs, then we turn it on the stomach, and then all apply on the back and the legs. This is our method. So every Vaidya has his own method. Then holding the pack with the handle, we have to rub on the patient's body. But here again the temperature control is very much important. The Vaidya or the therapist should check the temperature, whether it is optimal, whether it is a tolerable, and then only you have to apply on the patient's body. And when you feel that while rubbing, that naturally automatically the heat is reduced, and that heat is reduced, then again change the bolus which you have kept in the vessel. Take that 2 boluses and keep it that your used one in the pot where you have kept the mixture for the boiling. Do you understand? Actually it is a video type of the what you can say, the understanding is more, but this is just for the theoretical explanation, and afterwards you can see the videos of that thing also. So this is about the application of that rice boluses on your body. Sometimes it is momentarily touch is also there. Rice pack is kept on the body and take it out, again keep it and again take it out. So this is called as a momentary touch. Sometimes it is a pressure touch. You have to give the pressure and rub it in a specific direction. Then changing of the rice packs, as I already mentioned to you. Then you have to cover whole body, like the stomach or abdomen, then the chest, then the hands, and then the legs, from front side as well as from the back side. And last is, after completing the procedure for 20-30 minutes, how to remove the rice that is squeezed out from the bolus. You have to remove that rice from the body systematically. That is done in the Kerala by specific using the palm tree leaves. But here I have seen in the Pune especially, some Vaidyas, they are using also, very interestingly, X-ray damage films. They use the X-ray film to remove the rice from the body or the oil from the body. That is very interesting. Some also use the simple your towels to remove the body, but better way, use a little bit plain surface to remove the oil and squeeze the rice from the body. Then again the patient is asked to take rest. But after completing the treatment, Don't forget to apply the Rasnadi Churna on the vertex part of your head. Rasnadi Churna. You have to apply on the vertex part. Half an hour the patient will rest. There also we should avoid the air condition or the fan. Of course the room should be airy, I admit, light should be there, but it should not be too much direct air on the body of the patient. Of course you know that Swedan process in general we select as per the season as well. Swedan is more preferable in the rainy season and the winter season. Nobody prefers to do the Swedan in the hot season. That is very logical. Procedure is at one sitting it is done for 30 minutes to 45 minutes, but whole process there are different as per the patient's condition. There are the different packages. Some people are advised to do the for 7 days, some for 10 days, some for 15 days, and some for the 21 days. So 4 packages are applied, one week, 7 days. Then for 10 days, 15 days, and last is a 21 days package. So this is very useful to get the relief from the musculoskeletal disorders, but again we have to take care for the burns. Now in short last process I would like to complete of Swedan Karma, so that overall we will finish the Swedan Karma. The third important is a Pizzichil. Pizzichil, P-I-Z-I-N-C-H-I-L, Pizzichil, or it is also called as a Parisheka Sweda, Sarvanga Parisheka, or it is also called as a Kaya Seka. You have to do the Swedan for the whole body. So medicated liquids, it may be basically used as oil, sometimes decoction can be used, sometimes water can be used, sometimes milk can be used, anything can be used, but 90% times the medicated oil is used to pour on the body, for the whole body, remember. So beneficial effects again the same. It pacifies the vitiation of Vata and other doshas. Vata Prakop is reduced. It improves the stability and the stamina. It also improves your OJ content of your body. Immunity is increased. So it is very useful for autoimmune diseases. Write down, for autoimmune diseases. Your skin becomes more complex and with good luster. Luster and complexion of skin is improved. Sense organ performance is improved. Sense organ performance, Jnanendriya and Karmendriya, they are better functioning after this Kaya Seka. This is the best anti-aging treatment. Like Shalishastik, this is also good for Dhatu Kshayjanya Vata Prakop, degeneration in hemiplegia, paraplegia, traumatic pain, contusion, stiffness of the joints. Even some Vaidyas who are specialized, they can use even the what you can say the in and out period of the labor. During the labor also this type of the Avagaha Swed or a little bit Parisheka, this type of the methods are used by special Vaidyas. Now which oil can be used for Kaya Seka? This is very important practical note. Which oils are very used in which conditions? Vata Prakriti, Vata Pradhana, Vata predominant Prakriti, Hima Sagar Taila. Hima Sagar Taila. For Pitta predominant Prakriti, Chandanadi Taila or Chandana Bala Lakshadi Taila. Chandana Bala Lakshadi Taila or Kshira Bala Taila. Kshira Bala Taila. For Kapha Prakriti, Trifaladya Taila is used. For Kapha predominant Prakriti, Trifaladya Taila. For Sama Prakriti, Asana Bilvadi Taila. Asana Bilvadi Taila for Kaya Seka. Then very, what you can say, the complicated skin diseases of chronic nature who are not getting cured, which are called as obstinate skin diseases, Marichadi tail can be used locally. Marichadi tail parishek. Marichadi tail for eczema, psoriasis, etc. If the patient is suffering from neurological disorders, Mahanarayan tail or Mahamash tail. Mahanarayan, Mahamash, Dhanvantar tail or Karpasyadi tail. Karpasyadi tail can be used. In sciatica, Mahavishagarbha taila is used. Sciatica, Mahavishagarbha taila parishek, kayasek, locally. Degenerative joint diseases, Karpuradi taila is used. Karpuradi. Now, preparing these all the Kayaseka treatments, you must have the Dhara Pati or Abhyanga table. Basically, the surface should be little bit comfortable for especially Vata emaciated person. That means if you can use a little bit cushion on the top of the Abhyanga table. But if it is a Kapha Prakriti, you need not to apply the bed or the cushion on the Dhara Pati or the table. You can use directly rough table surface. Then nearly 1.5 to 2 liters of medicated oil is required for one sitting. 1.5 to 2 liters of oil, too much oil is required. This is little bit expensive treatment, remember. So while selecting the patient, one must know the economical condition of the patient. It should not be prescribed to each and everybody. It should be economically based. So rich patient can directly from their pocket, and for the poor people, you must go for the charitable hospitals like government hospitals. There they can perform because government give the subsidy for these oils. I am not saying for the poor people this should not be done. But for the poor people, if you want to do the Kayasek, admit him into the charitable hospital, then perform it. For the rich people, privately they can take this type of the costly oils and the treatment. So firstly, synchron massage is done always. Synchron massage is doing the massage with the two people at the same time. The two people are doing the massage, that is called as a synchron massage. In Europe, where I am running the center in the Spain, these treatments are very popular. Then head end of the table is little bit raised. Head end is little bit raised to drain the oil on the downward side. So table arrangement is very important. Then remember, here we are doing the recycling of the oil. Whichever the oil we are pouring on the body, that is drained with the hose at the, and it is collected at the down part of the table, and again it is poured into the gas on the flame. It is again heated, and again that is reused. So there is a recycling process of the used oil and the warm oil. Used oil, warm oil. Used oil, warm oil. This is called as the recycling treatment is done. Then again, after the procedure, you must apply or you must take out the excess oil from the body. Mop with the towels or the tissue papers. Apply the Rasnadi Churna on the head. Rasnadi Churna on the head part. Patient is taking the rest in the resting room with the gowns, and after 30 minutes he is asked to take a warm shower, or sometimes he takes the not really after the Kayaseka, but other treatments he takes the Yakuchi, but here already Swedan has been done, so he can directly go to the warm shower. And after whole day he has to take precaution from the cold atmosphere, AC room, or not going on the vehicle, not traveling too much. Even it is done at the level, basically this treatment should be done with the IPD patients. If it has to be done in the with the OPD level, then you must give the written instructions to the patient what he should do and what he should not do. Especially he must be protected from the open atmosphere, especially the ears, nose, head should be protected. He should wear the cap, then there should be what you can say the, what is the muffler in English? Shawl or something, the different precautionary measures around the ears and the nose and the head. These organs should be very well protected from the open wind or open breeze, because if he is traveling with the bike, that is too dangerous. All the symptoms will exaggerate after he travels with the bike. So don't go with the open vehicle, always it should be protected. With the car he should travel if it is a OPD type of the treatment. Basically this treatment should be given as a IPD type of the treatments. The patient must be admitted. While taking the bath, he should not use the soaps or synthetic material. That is important. No use of soap. Write down. No use of soap. Commonly you give the Lux and all the Medimix and all this. No. Give him some Bengal gram powder. Powder should be given for Udavartana, for cleaning the oil, and not the soap should be used, because soap again makes your skin or the body dry. Remember, no soap. Then afterwards, I will write down, or you should write down, which should be the strict instructions for the patient. Number 1, avoid too much physical exercise. Too much physical exercise, not allowed. Hectic lifestyle, no, not allowed for 7 days. Exposure to the extreme sun, extreme wind and extreme rain, not allowed. Avoid. What should be avoided? Extreme sun, extreme wind, extreme rain. No contact to the body of extreme sun, extreme wind and extreme rain. Then there should not be Vegavadharana. There should not be. No Vegavadharana for 8 days, 10 days, 15 days. No. Natural urges should not be suppressed. Whenever he is a urination, defecation feeling, he must go immediately. And these instructions not for only 1 day, because we are giving these treatments for 8 days, 10 days, 15 days or 21 days. For whole of the program, these instructions should be followed by the patient. Next is no excessive sleeping, especially in the daytime. No sleep is allowed. If he want to take rest, he can sit in the chair and close his eyes, but not lying down on the bed. No sleeping in the daytime. Not too much walking, too much sitting and too much talking also. All extremes should be avoided. Excessive talking, excessive walking, excessive sitting, all should be moderate. Then there should be avoidance of emotional disturbances like grief and anger. There should not be quarrel in the family. There should not be tension of his job. That's why I am saying the better patient should be admitted in the health spa. Health spa, and then you perform this treatment, then he will be benefited. Not at home, because there are a lot of home problems, job problems are there, so patient will not get relief. Keeping awake at night, this should be avoided. Keeping late at night, going to the bed at 12 o'clock, going to the bed at midnight. No, not allowed, not allowed. Go to the bed at 10 o'clock. Get up in the morning at 6 o'clock. This should be your normal lifestyle. Then no use of cold water for hand washing, mouth washing and for bath. No, don't use cold water for hand washing, face washing and your bath. Always use the warm water, always. So I have told you even the duration. So this is all about, I think, even this Nadi Swed. So my dear friends, today we have nearly completed the Swedan topic of this Panchakarma, Ayurved Panchakarma lecture series. In this topic today, what we have seen? We have seen basically the optimal Samyak Svedana Lakshana, then Ati Yoga Lakshana, excessive fermentation, and then we have seen the specific 3 types of Svedana Karma. First was Patra Pottali, second was Shalishastik Pinda Sweda, and last was the Kaya sega or the Pizzichil. Why it is called as Pizzichil? That oil you take, it is taken in the big napkin, and that oil is poured like in this method, pouring, pressing that cloth piece, and then the stream of the oil will pour down on the body of the patient. But that oil should come with your thumb. Again, this is a video, actually you must look for the video, but the ideal method to squeeze the napkin with your what you can say the fist, and then that oil stream will come through the in the line of the thumb. This is the ideal what you can say the position of doing the Kaya sega. Nowadays some Vaidyas are also using sponge. In spite of the cloth, they are using the sponge. Dip the sponge in the oil and just press it gradually, press it gradually. Sponge will also useful for this particular process. So all these audios or the Panchakarma lecture series we are uploading on the YouTube, which is very popular social media. So all of you recommend that you should prescribe or subscribe my channel, so that automatically you will get the intimation. Share that all the videos with your friend and take the advantage of this Ayurvedic knowledge of Ayurvedic Panchakarma. So thank you very much for patience hearing, and have a nice day. All the best to all of you. Thank you.